All right, good morning, everyone, and welcome to the fifth of six business and information listening sessions presented by the Wyoming Business Council. My name is Warren Appel. I'll be your facilitator this morning. Let's cover a quick housekeeping matters. I'll turn things over to Josh to introduce our agenda and panelists for the session. Written questions may be submitted using the Q&A function on the webinar toolbar. We will share these with panelists as time allows. Please do not submit questions via the webinar chat box. We are trying to monitor those questions, get responses back as they're asked, and they get lost in there sometimes. Individuals wishing to speak or ask live questions should utilize the raise hand feature on the webinar toolbar. Please keep your microphone muted at all times when you're not speaking and keep background noise to a minimum. This is, of course, polite for everyone on the call today, but will also help ensure we've got good audio on our recordings. On the subject of recording, yes, we are recording today. We will make this recording as well as those from our other sessions available on our website, wyomingbusiness.org, as soon as possible. With that, I will hand you off this fine Friday morning to Wyoming Business Council Chief Executive Officer Josh Durrell to introduce our speakers and agenda.
Great, thank you, Warren, and good morning, everyone. Thank you for joining in. These webinars that we've done so far have been, I think, very informative for both the folks who have attended as well as the panel to ensure that we have the right information out there. So thank you all for joining and being part of this today. As we do this, I do want to remind everyone that our goal today is to show you the changes that are going into effect today, in fact, and what those changes might mean to your business. And at the same time, we want to give you a bit of logic on the health metrics that are being tracked, as well as the decisions that are made for these particular orders, specifically orders 1 and 3 from the public health orders, and make sure that everybody understands really some of the logic behind us looking at lives and livelihood so that we can achieve a balance there and move into this and begin to open things up as much as possible and as much as makes sense for public health. During this time, we've heard many different points of view, and we definitely understand that there are specific county-wide or maybe things that are in your community that maybe are not throughout the state. And so we will be talking a little bit about those orders, as well as some of the ways that your county can get variances or exceptions for your business so that you can really make those local decisions. And we have assembled a fine panel of people today who can talk us through those orders and the changes, as well as open their agencies up to questions in the future so that we can ensure that, that Wyoming does open up in a safe and productive manner. Today we have Stephanie Pyle, a Senior Administrator from the Public Health Division, and Stefan Johansson, also the Deputy Director for Wyoming Department of Health, Sharon Bennett, the Executive Director of the Wyoming Board of Cosmetology, and Roxanne O'Connor, who will be representing the Department of Family Services. And this panel, again, a group of experts who have really made time to do this. You know, one of the things that I noticed throughout this entire crisis and entire process to try to open up businesses is that people are working really hard to find that balance and find solutions for businesses and our communities. And so I just do want to thank the folks in the business community for providing input, as well as those in the state agencies who have been working very hard and quite frankly have quite a bit of responsibility on their shoulders. So thank you all for joining, and thank you panelists for being here. With that, we'll talk a little bit about the agenda. And one of the things that we wanted to make sure that everyone understood is putting those health metrics first and understand how we're making those decisions. So the first thing we'll do is we'll talk about the metrics dashboard from a health perspective. We're going to take a look at some of the businesses that are still open or were always open because there are many, I guess, there are many messages out there about what businesses are and are not open. And so we want to do our best to clarify those. We'll talk about how childcare is affected in Order 1 by the changes, restaurants and dining, gyms and fitness. Then we'll jump into Order 3 that changes the personal services businesses and their ability to open. And then we'll talk about the variance or exception process. And then finally, we'll open it up to questions and answers. And with that, I'm going to turn it over to Stefan Johansson, who will talk a little bit about the health metrics. Stefan, thanks.
Thank you, Josh, and good morning, everybody. Before I go through this dashboard, I just want to say two things. Number one, thanks to Josh, Warren, the team at the Business Council for putting this series of webinars together. I believe this is our fifth webinar, and hopefully they're helpful to the folks that join our small businesses and business owners across the state. But I can tell you they're extremely helpful for us in the health department to really hear both some clarifying questions as well as some feedback on things that might not be clear, some guidance that we might be able to put out, or things that we could clarify further to make this process a little bit easier. We know that it's been a difficult time across the state of Wyoming, and we're, as Josh said, trying to strike that balance between protecting livelihood in Wyoming and also protecting lives. And secondly, I just want to thank all of you, our business community across the state, for taking time out of your day to join this webinar and work with us on trying to make this process better and easier. And hopefully it'll be informative for you, and hopefully we can answer some of your questions towards the end of the presentation. So without any further ado, I'll just go into some of the metrics that we're looking at to really inform our administrative and legal decision making as a state with regards to the COVID-19 outbreak. And we're looking at these metrics both statewide and on a county by county basis. As Josh mentioned, we know it's not really one size fits all with this outbreak across our different counties in Wyoming. We have counties that have more cases and concerning number of cases, and counties that really don't have any at all or have been relatively low and have been maintaining kind of a low caseload throughout this entire outbreak. So we want to make it clear that we're looking at these metrics statewide as well as in your individual counties. But what you'll see on your screen, I'll start on the left-hand side, is really what we call our epidemiological metrics. And that's, again, what is kind of most important here. And the first one that everybody will be aware of is we monitor the number of cases that Wyoming sees and diagnosed positive COVID-19 cases on a daily basis. What we want to see here is a sustained reduction over multiple weeks of the number of new cases that are diagnosed every day. As you probably know, that's a function of our ability as a state to conduct testing, which is limited. It's been limited in every state across the country, but also very important from a diagnostic standpoint so that we keep understanding what the burden of this disease is across our state. You'll see that's the only one that we've graded currently as of April 28th, the only one that we've graded as concerning that's marked in red. We have seen some uptick, especially in the last week, and primarily over last weekend and Monday, of some additional cases that came in that kind of spiked that curve a little bit. It's not anything that I would say was extreme, but we did see from Sunday to Monday of this week an increase of 19 cases in one day. Like I mentioned, that is not indicative of the situation across the state. That was really in a one or two county pocket, but we really want to see that statewide and on a county by county basis stabilizing and reducing as much as possible. The second metric that you see there is the percent of those positive cases that we attribute to community spread or community transmission. And you may have heard those terms, and I want to explain a little bit what it means. So when we have a case that's diagnosed as positive for COVID-19, our team of epidemiologists at the Department of Health, they do what's called contact tracing and investigations, and they try to determine when someone is positive, how did they contract the illness? And what we typically see, or what we'd like to see, is the ability to identify a direct contact, either someone who had COVID-19 that this person came in contact with, or some other sort of direct exposure, maybe being in a facility where there was an outbreak or a cluster of COVID-19. When our epidemiologists can't trace that to a known exposure or a direct contact, it's attributed to what we call community spread, which means we don't know how that person contracted the illness. There doesn't seem to be evidence that supports a direct exposure, and we attribute it to community spread, which means in general terms, we know that there's more widespread illness in the community. And we really want to see this percentage, like you see on the screen there, maintain stable or reduce. And right now we're seeing about a 20 to 25% of all of our positive COVID-19 cases that are attributed to community spread. So we really want to see that hold or reduce over the days and weeks to come. And we have seen it be pretty steady over the past several weeks, again, at about 20 to 25%. Finally, on the epidemiological side, we look at the percent of all of our tests that are positive. And we want this to also kind of maintain or reduce over time. And right now, Wyoming, in addition to some of our neighboring Mountain West states, we look relatively good compared to some other states in the country and some other countries around the globe. We're seeing about a 4 to 5% positive rate of all of the tests that we conduct. And as of yesterday, the state of Wyoming, through its public health lab and its private and commercial and hospital-based labs, there's been about 10,000, maybe a little over 10,000 tests that are conducted. And we're seeing, like I said, around a 4.2, 4.3% positive rate for all of those tests that are conducted. That number could change as more testing comes online. But again, as we're able to test more, we really want to see that number maintain or reduce. And that will tell us that, that again, we don't have either larger amounts of community spread or a greater burden of disease with COVID-19 that we would like to see. On the right-hand side of your screen, you'll see hospital capacity and really healthcare system capacity metrics. And this is intended to help us monitor any surge or demand or volume that might be troubling in our hospital system. Obviously, Wyoming doesn't have the number of cases or the population that many of the states that you see in the news regarding COVID-19 have. But we have been very, very careful to monitor our hospital capacity to make sure that if we do see a resurgence of the virus or an uptick in the number of cases, and especially the number of people who might require hospitalization, that we have the healthcare system capacity to be able to handle it. So the three metrics you see here, we track on a daily basis. Our hospitals report this to us on a daily basis. And it starts with the total number of COVID-19 admissions in our hospitals. And as of yesterday, we had statewide, I believe, 12 COVID-19 patients reported in hospitals across the state. And that number has been relatively stable over the past week and a half or so, with that number not looking too concerning, but again, that can turn on a dime in any given day. Secondly, we look at our total hospital bed availability and our total ICU bed availability. Again, we know that some folks like elderly folks or folks with underlying medical conditions can be uniquely susceptible to more complications when it comes to COVID-19. And it's very important that our healthcare system and our hospital systems can handle a potential uptick in utilization if the virus were to spread more widely across Wyoming, which is what we're all trying to prevent. So the last thing that I'll mention, Josh, is that I think it's important for everybody to know that we're considering these metrics. These are the high-level metrics that you see on the screen. We're really looking at them, again, on a daily basis, but holistically and somewhat impressionistically to see how the state and how our counties are performing when it comes to the spread of this virus. And the reason I mention that is because it's very difficult for me to take one of these metrics, for example, a certain percentage availability of ICU beds across the state, and tie it directly to one provision of one of our public health orders. For example, if we hit a certain percentage of ICU bed availability, then we would open up trade schools, for example. Most of these don't really tie directly to some of these administrative or legal actions, which is frustrating, and it's frustrating for all of us. But we really have to look at this system as a whole, look at our state as a whole, and look at our counties as a whole, and see, we really, to put it simplistically, want to see more yellow and green across this report card so that it informs us that maybe we can take on, as a county or as a state, more risk in easing restrictions and opening up more businesses. So I know we'll do some Q&A at the end, but Josh, I'll stop there, and I know folks can feel free to use the Q&A function if they have questions over the metrics. Thank you.
Great, thanks, Stefan. Really appreciate that. And I think that's the key. I mean, I think we want to take a look at this and make sure that we're tracking along with what the health metrics are, and make sure we're paying attention to them. And again, I think one of the keys to this is that as we open things up a bit and relax these orders, we want to do so in a way that doesn't cause them to go all red, because again, that can cause us to really lock things down. And as we've heard from some businesses, that's actually going to be more challenging for them if they have to start and stop. So again, thanks for that. And let's jump to the next slide and talk a little bit about what businesses are open and have always really been open. And this slide is really intended to help people understand and kind of communicate out there that really sometimes the messaging you're getting from national news or other states' news, it may not apply to Wyoming businesses. And this can be really challenging in a time when let's be frank, it's tough to read those orders and fully understand, because they're written in a way that it makes sense for legal folks and government people, but the plain English part of it is kind of challenging. And so one of the things that we wanted to make sure people understood is that many businesses have been open the entire time. And we want you to read those orders carefully to see what restrictions may or may not apply to your business. Many businesses have had really very few restrictions, if not zero restrictions during this time. And so we get a lot of confusion around that because of the messaging we're getting at a national level and from other states, especially if you're near the borders of Wyoming and you're not listening to the news from the Wyoming source. And so that can be pretty challenging. One of the things that we get a lot of is what's an essential business or a non-essential business, and that's really only relevant in our orders to childcare providers. It's much more prevalent in states that have those stay-at-home orders and things like that. So we just want to make sure that people really think through this, read about those, and understand that the messaging you're getting may not apply to you. And so reading those orders is important, and also reaching out to your county public health or county health officer to find out the details on whether your business is impacted by these orders. So really just taking I was hearing yesterday from one community about how they wanted to open up their store, and I thought to myself, well, I'm not positive that your store was ever really required to close. So Laramie businesses, I know in Laramie there have been a number of businesses that are definitely non-essential in that category that were open. And again, I think it comes down to making sure you understand the orders and making sure that you can run your business effectively. And that will continue on as these orders continue to appear. Along those lines, we at the Wyoming Business Council have developed a website that allows for businesses to put their new service offerings, their new hours. Many hours have been adjusted, and the service offerings of those businesses have been adjusted. And if you go to wideopenwyo.org, you can view the map and take a look at the businesses that are open and what their hours might be. If you are a business owner, which I'm sure most of you are on this website, or excuse me, on this webinar, you can go to the top right of that website and add your business. Many businesses are already in there. Some chambers of commerce and Main Street communities have provided those lists, but it's definitely something you would want to go in and make sure that your business is represented correctly. I also want to say that many of your social media channels and website and Google listings, double check and make sure that those are accurate, and make sure that you have done your best to promote your new services and hours during this time. Again, the key is to make sure that your customers know what their expectations are and to know what your hours are, so you can collaborate with your customers and have the best experience possible for them. We'll also take a quick look at another website that, while it was not created necessarily for Wyoming or by a Wyoming company, it's created by some states in the southeast portion of the United States. It does have a number of great tips and techniques for various types of businesses, whether it be retail or service oriented, in order to make sure that you are opening and that your business is running as smoothly as possible during this time. This is just one of the many resources that are out there. And one of the things that we've noticed is that sometimes in a time of crisis, you tend to sort of really focus just on your business and making sure that that is working, but you don't necessarily lift your head up and look out there and see what's going on. And while we definitely advocate for you to really pay close attention to the numbers in your business and making sure that you're doing the right things for your business, it's really important at this time to collaborate with the other businesses in your community to find best practices across the state, and make sure that you're looking out at these other examples of how to best run your business during this challenging time. So we really wanted to just showcase this particular website as a good example, but there are many other resources out there, and we suggest you utilize those. As we jump to the next slide here, we do want to now get into really what everyone is here for, is to take a look at what is changing today and what that means to you. And we're going to go through each of these sections. So in order one, we have childcare, restaurants and dining, and gyms and fitness centers are all affected today. And then we'll go into order three with personal services. And then if your business was not really impacted or changed by the order changes that went into effect today, we're going to take a look at the variance and exception process so that you can fully understand that. With that, we're going to turn it over to Roxanne, who will talk a little bit about childcare and make sure everyone knows that her agency is ready to listen and to help you through this process. Roxanne?
Good morning. Thank you, Josh. Thank you, Warren. Thank you to the Business Council for putting on these great webinars. I echo exactly what Stefan said. This is great information for us to be able to gather and ensure that we are communicating the information that we need to be communicating in order to assist childcare facilities and other businesses with really what's an exciting day in Wyoming. Is the day that we've been waiting for quite some time. And so we're seeing some progress, and we want to make sure that we are available to support all of our providers out there. To back up a bit, my name is Roxanne O'Connor. I'm the Support Services Senior Administrator for Department of Family Services, and childcare licensing falls under the purview of support services. So that's why I'm here speaking to you today. As we've referred to a couple of times already, the new orders from the governor from the Wyoming Department of Health have gone into effect today. And part of that order is that childcare can either reopen with some requirements that need to be met, or they can increase capacity with the requirements that you're seeing on your screen right now. Those might be a little small on your screen, but we have sent those out to all of the providers that we have on our email distribution list. So please, if you need to refer back to these, check your email. If you didn't get an email from us, which we've been sending out a great deal of communication over the last 5 or 6 weeks or so, please feel free to email me and we'll make sure that we get you on our distribution list. It's the way that we communicate updates. It's the way that we communicate technical assistance, learning opportunities. So I would really encourage you, Warren, maybe if you could put my email address in the Q&A or the chat box, to email me if you're not getting those communications, because they really are important, and we really try to make sure that we're reaching out as much as possible. Like Josh had alluded to, childcare, because it is an essential function for those employees that are serving other essential functions, we actually were able to maintain about 45% capacity even throughout all of the orders that have been in place and the restrictions that were in place over the last 5 or 6 weeks. Which is really a great thing. One, it made sure that we were able to serve the individuals that we needed to serve during this time, and they were able to go and support our communities in other ways. But there was also a great learning experience by many of those providers who were able to stay open and really get creative while still meeting the requirements of the orders of the Department of Health of their local communities. And so we encourage you, if you are struggling with exactly how to make these requirements work in your facility, if you have questions, if you have innovative ideas, please reach out to us. Please reach out to other providers in your communities who have stayed open to see how they may have been able to be successful in doing so in the last few weeks or so. That really leads to, we've had such great collaboration with the Department of Health, with our local county public health entities, and we want to continue to do that. So oftentimes, if you ask us a question that pertains to the orders, to some of these requirements that you see on your screen, you may hear that we need to either discuss that with public health, we may refer you to public health, but we want to make sure that the balance between our child care licensing rules, which still need to be met, and these requirements is a coordinated balance, and one where you're not getting information that is contradictory, but that the information is helpful, and that we are able to find a balance between those two requirements that you as child care providers have. So we can't encourage enough for you to reach out to your supports in the community, your supports here at the state level. We're all working through this together. There's going to be gray areas. There's going to be questions that come up. Each facility is unique, and we want to be sensitive to those varying factors. So we want to make sure that we are providing the support that you guys need in order to be able to serve our essential personnel and ultimately the families that you were able to serve before COVID hit our state. With that, Josh had put up a couple of websites with different businesses around Wyoming to identify which ones were open and kind of a status update. We at DFS also have information about specifically childcare providers on our website. So you may have been hearing from licensors, if you are a childcare provider, asking, are you open? What's your capacity? Who are you serving? Do you need substitutes? So we were able to put that website together to be able to make sure that we had information out for the communities and families, and also the providers within our communities to know and understand what's going on. So I would encourage you to go out to that website and also make sure that your information is up to date. And you can contact your licensor if you need to provide updated information. Let's see here. Just a moment, I'm going to mute myself, just a second. I apologize, as you can hear, I'm a working mom with children myself, and we don't have childcare, so I have experienced this issue from a number of different perspectives, but I appreciate the understanding. I apologize for that. So again, we just want to emphasize on the coordination that we have with public health. We want to ensure that personnel of essential families are being served first and given the priority, and that to clarify that if you are serving individuals of essential personnel, that we would like for them to be the priority, but also if you have individuals that are needing childcare that aren't serving essential personnel, and you have questions about whether you need to open up your facility and create spots for essential personnel and not take those families who have already been enrolled in your facility. To clarify, you can take those families that are already enrolled, but those that are serving essential personnel, we want those to be your priority. And then next comes those families that have already been enrolled in your facility. So that's a point of clarification that we wanted to provide with these requirements. And we've had other questions about face masks and how do you put those on a 2-year-old, and really the requirements say whenever practicable. So do your best, work with families, see if it's something where the families can help the children get used to face masks at their homes. But we're all going to work through this together. We're all going to have some understanding and some grace as we work through this, and we are right here alongside you to help. So again, thank you for all of the coordination, all of the partnerships, and please reach out to us if there's anything that you need.
Well, thanks, Roxanne. I appreciate that. And next, we'll move into order number 1, the changes for restaurants and dining. And Stefan will be able to provide a little bit of information about that, the changes that are there, as well as some of the logic behind that. Stefan?
Thank you, Josh. So I think the moment everybody's been waiting for is really when can we go back to the restaurants and the bars, and for you as business owners, potentially when can we open up our restaurants and bars? And I wish I was here with better news. We're not quite there yet as a state with our metrics. Now that could vary county by county, and we'll talk about that exception and variance process here in a little bit. But the big change from order number 1, specifically as it applies to restaurants and dining, is the ability for customers to go into the restaurant, as you see there on your screen, 5 at a time, and pick up food or beverage orders while maintaining some social distancing there. So again, I know that's not great news to everybody, and we wish it was different. We wish it was more of a reopening, but like I said, we're not quite there yet. But as Josh mentioned, what I wanted to kind of explain is the logic behind and the strategy behind the easing of restrictions that the Department of Health is taking. And as you know, we have 3 public health orders into place, and they kind of worked sequentially. So order number 1 really restricted or closed certain types of businesses that solicit larger gatherings of people. So think of restaurants, bars, childcare facilities, schools, gymnasiums, etc. And order number 2 just kind of took that concept on a more general public basis. So gatherings of 10 or more were prohibited. So think of things like public events, conventions, sporting events. That was really the logic behind order number 2. And then order number 3 was really those personal care services that may not solicit large gatherings of people, and in fact, often they're kind of one-on-one provider to customer interactions, but they represent kind of high-touch services and more of a unique public health risk when it comes to the spread of the virus. So order number 3 kind of handled those personal care, hair salons, nail salons, massage therapy service types of business. And now as we start to see some of our epidemiological metrics stabilize, and we're able as a state, a Department of Health, and a governor to take on some more risk with easing these restrictions, we're kind of moving backwards because what we know about this virus is very limited. There's not a whole lot of information. It's a new virus. We're learning more and more every day, but the evidence and the data is limited. What we do know is that one of the most significant contributors of the spread in any community with COVID-19 is large gatherings of people. So when we talk about easing these restrictions, the reason you see order number 3 really being eased the most as of today, as of May 1st, is because it's a little bit easier to control for those businesses to limit spread or potential spread of the virus. So you might be asking yourself, why could you open or allow to open hair salons, nail salons, massage therapy, et cetera, and not restaurants with limited seating? And that's really the logic. So you don't think that we're just shooting from the hip here. But I want to stress that nobody around the globe or in this country or in this state, we just don't know everything about this virus. So we're trying to, like I said before, take all of the data and the evidence holistically and see how much risk we can take on. As we learn more, as we're able to test more for COVID-19, those targeted types of decisions, legal and administrative, will be easier to make. But right now, again, when we ease restrictions, we're starting with those services that are a little bit easier to control when it comes to larger gatherings of people. So Josh, I'll stop there. I know there's probably a lot of questions about that we can handle on the Q&A. Yeah, that really with order number one as it applies to restaurants and dining. Unfortunately, the big change here is folks can enter the restaurant to pick up their food or beverage orders while maintaining some social distancing. Thanks, Josh.
Yeah, thanks, Stefan. And we will, I do want to stress that we have these slides available after the webinar at our website, wyomingbusiness.org/transition. And those, that way you can read those, but we also have links, and these are probably the best place to get those links to the Department of Health website where the orders are listed out as well, so that full order is available there. I think that's really the key. These are a bit of they're not paraphrased necessarily, but it's a slice from that particular order. So for anyone who is looking to see these, it may be a little challenging on your screen, but they're available for download after the webinar, as well as links to the orders themselves. With that, we'll jump to the gyms and fitness centers. And again, there are some changes here, most notably that gyms and fitness centers may open up, meeting these requirements. And that goes for, so gyms and fitness centers, as well as personal care centers that we'll talk about next, those may open up if you meet these guidelines and if you work through these guidelines, and you do not have to request permission or get any kind of exception made from the county health officer or the state health office. You just need to make sure that you meet these guidelines and requirements. And so we're going to walk through a few of these that maybe might be a little bit that you might have some questions on, so that we can ensure that the gyms and fitness centers open up appropriately. I think first things first, we'll go through these a little bit here. Staff must wear face coverings at all times. And the management should also ensure that employees that present symptoms will not be permitted to work. And so one of the things that a question that came up was somebody said, well, what are those symptoms? And so the Department of Health has put out some guidelines, and we've got a link to that page at the end of the webinar now, so that you can see those. But there are guidelines on what those symptoms are and what you should be looking for as an employee and as an owner of a business. One of the things that is probably somewhat unique to fitness centers, obviously, is that whole idea of one-on-one personal training or weightlifting that requires a spotter. Locker rooms typically are a place where it's maybe difficult to clean fully, and it's also an area where people can congregate. So those will remain closed. Please, respect that social distancing and with your equipment by spacing those things at least 6 feet apart. And then you also need to think about cleaning up after your customers. I know in a lot of gyms, most gyms now, the customers actually clean up the equipment after themselves. However, the staff is really the people that should be cleaning that, because they will do probably a much more consistent job. They understand what it takes to fully clean, and that way we can ensure some level of quality control. And so that's a key component there. One of the big questions that we get has to do with whether group workouts are available, kind of those classes. And at this time, group workout classes are prohibited, and no more than 9 people are allowed in a specific room or confined space at any time. Again, the key there is that social distancing and making sure that you have that appropriate, and making sure that your space makes sense. We would like you to maintain a record of customer usage, date and time, because obviously we want to make sure that if contact tracing is necessary, that we will have the information to do that. And then, again, you won't necessarily be required to do that contact tracing, but we would like to have that information so that the Department of Health can track down people that might be exposed to folks who have tested positive for COVID-19. There are some limitations there in terms of the number of people per square foot in your facility. Again, some gyms are just really kind of a big warehouse, in fact, so making sure that you have the right number of patrons there. Swimming pools need to be limited to 1 swimmer per lane, and spas and saunas must remain closed. Now, I'll say that we have had quite a few questions about dance, gymnastics, martial arts. those types of those types of classes. And some of the things that we know is that this doesn't fit everything, and that's a real challenge from a state level, is to try to fit all of the nuances that are available. And so with those, what I would recommend is that you reach out to your county health officer, try to understand how you could perhaps either create an exception for your business or band together with other similar businesses and perhaps get a countywide variance depending on that, again, the restrictions that you have and the county health officer's take on that. So again, really try to work together with the gym community or the businesses that are similar to yours and come up with some ways that you can both operate safely for your customers and employees, but also go back to your business. So that really kind of concludes the changes for the gyms and fitness centers, which it could be today. I know that many people are probably really welcoming that, and I know that the gyms have a tough job ahead of them, especially if you're my gym. I know that over the last few weeks I haven't done a whole lot. So we'll jump now into the personal care services, and we will allow Sharon Bennett to talk a little bit about that. She's the executive director, or excuse me, the executive director of the Board of Cosmetology. Sharon?
Good morning. I just wanted to thank you guys for doing this. I think it is a great way to get information out, and I learned something every time I sat through this, so it's much appreciated. The orders that were put out to the modified orders that are allowing our salons and barbershops to open today are all on our webpage. We have some other documents there that may be of help, just as far as some reopening guidelines, make sure we're getting everything ready to go for our clients. Yesterday, somebody asked about somebody walking into their salon without a face mask. And after talking to some folks, if you get on and really look through all of these conditions, they actually help you. They can help you, one can help you enforce another. So it does say on here that services need to be provided by appointment only. This is going to be new for a lot of our barbershops and some of our hair salons as well. But if they take advantage of this, this is going to give them a chance to talk to that client prior to the client walking in. And this information, I think, is really good to share with your clients, what you're going to be doing, what's expected of them. So in thinking about that yesterday, if they follow that no appointment, only by appointment only completely, then they will have had contact with each client prior to them walking into the facility. We also talked to a few salon owners yesterday, and they are actually posting on their door, right out there, as you're walking in, no walk-ins, by appointment only, with the salon number. And if anybody does walk in, they can simply tell them that, the number's on the door, please call, we'll get you in as soon as possible. I think that may help that, just stopping that right there. I just have to tell you, our licensees are, they're just amazing people, and their patience and understanding through this whole thing has been wonderful. I just had to put that out there. But we're here. If we can't answer questions, we have wonderful people at the health department to help us. Our rules and regulations still apply. We're an infection control agency. They need to make sure that they're following all of that. It's more important now than ever before. And we've said this every time, and I'm going to say it again. We need to do this right going in. You can be open today, and for those that are, I wish them the best. But if you don't feel you're ready, take the time. Let's do it right the first time and keep everybody safe. So I'll just wait till the end to see if anybody has any questions. Thanks.
Thank you, Sharon. Really appreciate that. So now we're moving on to the variance and exceptions portion, and Stefan is going to talk through the process for this, but I do want to make a general comment, and this is based on some talks with county health officers, and it has to do with helping everyone understand that everybody's doing the best they can, utilizing the data that might be available to them and about their particular county. So really having that open dialogue is critical with your county health officer, and also having an open dialogue with those businesses that are similar to yours. Right? If you are a restaurant that wants to try to seek an exception, it might be better for you to connect with other restaurants that and get together and come up with a variance for your county. It also for gyms that maybe want to offer classes, you may want to again get together with the other gyms or fitness centers in your area and come to the county health officer and have that open dialogue. And I think that's really, really critical. And then that way they're not going to get bogged down. You're likely to come up with a plan that fits better, and perhaps even, and again, I don't want to set any expectations, but perhaps even do that quicker than if everybody goes in with a individual exception request. So Stefan, if you wouldn't mind taking everybody through this process, I'd really appreciate it.
Sure, thanks, Josh. So it's important to remember that throughout the process for the past month and a half with these public health orders, there has been the availability within the orders for what we call variance orders and what we call exceptions to the orders. So just to describe the difference between those very briefly, what is known as a variance order or a county-wide variance order is really at the discretion of the county health officer with the state health officer's approval. And the variance order would really be a replacement of one of the state orders on a county-wide basis. So that's that, whether more restrictive or less restrictive. So think of order number one with the restrictions and some closures of restaurants, bars, schools, gyms, et cetera. If a county wanted to do a completely different order, for example, do a countywide variance where restaurants are able to open up for outdoor seating, for example. That's a question that's come up quite a bit. That could be handled through the county health officer for a countywide variance that would apply to the entire county. What I think a lot of folks on this webinar as business owners and members of our business community may be more interested in is the exception process. So within those three public health orders from the Department of Health, there is the availability of requesting an exception to a specific provision in the order. So much more narrowly focused, but that exception process is certainly there, and also runs through the county health officer. So when you hear us say county public health office or county health officer, we're really referring to that county public health entity that's kind of the gatekeeper of both variances and exception requests. So what you see on your screen here is just a really simple process that we wanted to put in place that gives, strikes that balance between the right amount of local and county control, as well as what we need, legally speaking, and from a public health standpoint of approval from the state health officer. So what we like to see in this process, first and foremost, is really local discussion on any sort of variance order or exception request. So you see some of the county partners that we would like to be involved in the discussion with the county health officer, county commissioners, law enforcement, county attorneys. We want that communication and buy-in on any variances or exception requests as much as possible. And like Josh has mentioned, I think it's important here to point out that as business owners, whether you own a gym or a restaurant or a bar or any other type of business that might be impacted by one of these three orders, it's really important to communicate with each other. Even if you might be, competitors in a local town, I think that's important to, if you have a plan to reopen where you might want to request an exception from your county health officer, talk to your colleagues, talk to your peers in the business community about how maybe they would do the same thing or maybe something different. And the more that you can do that and then communicate with your county health office, that's going to go a long way in terms of kind of having a unified a plan across different sectors or across different types of businesses. But the process is relatively simple. That local discussion happens. The county health officer considers any type of planning documents. For example, if a business is requesting an exception, what's their plan? How are they going to maintain distancing, sanitation, hygiene, those kinds of precautions that the county health officer can consider. And then ultimately, the county health officer will approve or deny if it's an exception request. And if it's approved, he'll discuss that with the state health officer, whether it's a variance or an exception request. And then ultimately the state health officer consults with the Attorney General and either approves or denies it. The last thing that I'll point out, Josh, because I know we want to get to some Q&A here, is that we do have 23 different county health officers and 23 different local conditions at the county level of what's happening with COVID-19. So I want folks to understand that, this process being in place, which has been in place for the past, month and a half, in these orders, it doesn't necessarily mean there's a super highway to exception requests or variances. It really depends on those county conditions, and we're giving discretion to the county health officer and the county public health office to make those decisions. So your business might be in a county where the county health officer isn't considering any sort of exception requests or variances for restaurants, for example. But you might have a business in a county that the county health officer is considering that. So I don't mean to put too much pressure on the county health officer or the state health officer, but just want to be clear that while the communication is really key, and you should be talking to your partners and your county health office on any of these plans that you might have, there's no guarantee that they will move forward. And in fact, we do have counties that have more restrictive orders in place than the statewide orders. So it can go both ways, and there's folks on both sides of the coin. So I'll stop there, Josh, and hopefully we can move to some Q&A here pretty soon. Thank you.
You bet. Thanks, Stefan. And it's not really a confusing process, but it is something that you need to take careful consideration and maybe do a little homework first, for sure. We know that many people will take this process and use it if they can, and so we want to make it as clear as possible. So thanks. I think you did that. We do have a number of questions that are available for answer here, so I'm excited to go through a few of these. I think these are really critical and some really good ones, some we haven't heard before, so this is fantastic. Diana asks, if a business has a case of COVID, for example, in a gym or a daycare, will you close it down again?
Yeah, that's a great question, Josh. And I think I'll say it depends, but the general answer would be it's likely that would happen. And I think that would, again, the gatekeeper there will be the county public health office and the county health officer, where if we trace a case back to, a specific business where there might be, some transmission going on, that it's likely that a suspension of service would be put into place at the county level. I don't think, to be clear, that would necessarily mean that the state health orders would come statewide and say, okay, we had a case or two or a cluster in a gym, for example, in one county, and so we're going to completely rescind the easing of restrictions statewide on gyms. We'll consider those on a case-by-case basis and a county-by-county basis. But again, I think it's mentioned in the orders, and happy to send you that language, where the business would be directed to work with the county health officer on any next steps as it pertains to reopening, especially after a case might be identified.
Very good, thank you. We do have a number of questions about restaurants and maybe what the potential orders might be if they are to be opened up in the coming weeks. And I do want to say that those are not finalized at this time, and we don't have a ton of information, but we are putting together some restaurant specific webinars so that we can talk about, how to prepare for a restart, what kind of lead times you might have, and also, of course, to provide a listening session so that your questions can be asked and we can integrate those into the coming orders. So just in terms of restaurant restart and things like that, we will be, stay tuned for new webinars on that coming up over the next week. All right, here's another question, and this one might be a little bit challenging, Stefan, just because timing is dependent on the county itself. But it's the question is from Tim, and he asks, what is the anticipated turnaround time for variance and exception requests? Are counties being encouraged to meet requests within a certain period of time?
Yeah, Tim, that's a great question, and I'll take it in kind of two parts. On variance orders, like I mentioned, it's a little bit more involved than an exception request because it's countywide. It would kind of be a replacement of one of the statewide public health orders. So that typically, the county health officer has to work with the county attorney in that county on language and the legalese that frustrates all of us, as well as the state health officer, who then works with the attorney general on getting that order put into place. So I can't give you a definitive timeline on that. Over the past month or so, there haven't been many countywide variance orders. I believe 1 or 2, if I'm not mistaken, and they've turned around pretty quick within a week. With exception requests, at least in the past month or so that they've been available in the orders, those have turned around, I think, in less than 24 hours for the most part. But I want to stress here, as Josh has mentioned on some of our previous webinars, if there's a run on the bank, so to speak, and we get 100,000 exception requests, then that's going to delay that time that we can essentially turn those around, both with the county health officer and the state health officer. So that's why, again, it's really important to communicate locally, communicate with businesses of like services and the same type, so that maybe those could be combined into specific exception requests. And if that's the case, then the county health officer might say, okay, I have a dozen restaurants that are proposing something similar, so this might be either an exception request or good for a countywide variance order that could cover them all in kind of one foul swoop. So the timeline has been relatively quick so far, but I don't want to put too much pressure on our county folks and our state health officer to hold them to that in case the volume does increase. So Tim, I hope that answers your question.
Thanks, Stefan. Thanks, Tim. We do have a question from both Ashley and Pamela about, I think these are very similar. They really kind of have to do with dance studios or maybe kid activities that are class-based, fitnessy type things, but not specifically. So how are we handling those, Stefan?
Yeah, it's a good question from both Ashley and Pamela, and I'll take dance studios first, because that kind of it's not really a gym. It's not really fits nicely into one of the definitions that we have in these orders. I would say, Pamela, not to frustrate you to death, but talk to your county public health office, talk to your county health officer about any plans to reopen or resume services, because it really depends on the kind of space you have, the kind of square footage you have, of what might be considered acceptable or safe at a county level. So I wish I could give you better information and advice there, but we do have some dance studios that are more like gyms, and others that are more like almost like schools for or would fit more into that kind of category. So I wish I had a better answer on dance studios there. When it comes to groups of kids or classes in a gym, this is a perfect example of how the statewide order might necessitate some sort of exception request here. So for your particular gym or exercise facility where you might have classes of children where there's no confined space issues, or you're able to distance, or you think you're able to provide classes on a safe basis, then again, I'll just be the guy that frustrates everybody and say that's a good example of why you should talk to your county public health office and your county health officer on the ability to do that. Because right now, Ashley, for a gym, you can see in the order that specific group activities are prohibited with the reopenings, but that exception request process could be useful and could be a potential avenue to reopen. But that discretion will be with your county health officer.
Great, thanks again, Stefan there. And then we are going to take a question live. We do have Brandon who has his hands up. His hand up. I'm going to allow him to talk now. And let's see, Brandon, I think you should be allowed to talk now.
Josh, I apologize. I didn't mean to push that button.
Well, you know what? That's not the first time that's happened in these webinars as well. And we're coming up on the top of the hour. We do have a couple more questions that are probably best handled offline. And so we are going to take a look at those and connect you directly with the expert that will be able to help you with that question. As we close today, I do want to thank again our panelists for providing such great information and being available over the course of these last few days. I think it was Sharon who mentioned that today is a pretty exciting day because I think for many of our businesses around the state, they're now able to open up in a limited capacity and really, kind of come back out of that shutdown. And I think that's really important. And again, I also want to make sure people know that there are many businesses that have been able to stay open in a limited capacity or just as they had before. And so to make sure that you review those orders and make sure that they truly apply to you, don't just take what you hear on a national news scene or from other states as gospel or from other businesses within your community. Sometimes they may not have the perfect information. And again, thank you all for joining today. We've definitely learned a lot about what information is important to provide to businesses around the state, and we really appreciate your hard work, your patience, and your creativity and collaboration with your community and the state. We take all of these questions seriously. We take your business seriously, and we know you do as well. And we just really appreciate the resilience of Wyoming business owners and the communities around Wyoming. And so we thank you for your time today and wish you the best luck as you move forward to reopening. Thank you.